Our team coverage continues right now with Rebecca Pryor, who's digging into concerns over payroll data at the state health department. Rebecca.
Yeah, this analysis looked at thousands of state salaries and found that as frontline caregivers could be facing cuts, hundreds of Maryland Health Department employees are making more than the governor. Meanwhile, collectively, those top earners also raking in millions in overtime.
Leave no one behind.
In last year's budget, significant cuts to the state's Developmental Disabilities Administration, or DDA, largely avoided, following pushback from concerned parents and caregivers.
Please help us.
But now those cuts back on the table, staring down another $1 billion shortfall. Lawmakers eyeing $150 million in DDA reductions, with almost half of that coming from self-directed care. That's the program allowing individuals with special needs to stay at home, choosing their own staff, services, and schedules instead of being placed in a facility. But for the thousands of families who rely on that support, they fear less pay will drive away long-term caregivers who they can't afford to lose.
If their pay gets cut, they're going to quit. They told me that. They can't. I mean, what else can they do? They aren't even going to have a living wage.
Joan Warren isn't just a worried mom. She's a PhD-trained nurse with years of experience crunching numbers, leading her to take a closer look at publicly available state payroll data.
I was noticing a lot of overtime as well as high salaries. I thought to myself, there's something really amiss here.
Her analysis of the Maryland Department of Health's payroll records, finding the top 6%, nearly 500 employees, making more than the governor's $188,000 salary. Collectively, that small group taking home nearly $142 million, about 18% of the agency's total payroll. Additionally, Warren finding $49 million in overtime costs, with almost half of that overtime going to those top earners. In some cases, individuals making more than $100,000 just in overtime, on top of six-figure base salaries.
We had 2 employees actually doubling their salaries. So that to us was very disturbing. I realized that many jobs, especially probably in the Maryland Department of Health, are possibly physicians, etc. However, that seems very excessive when we're looking at taxpayer dollars paying somebody working and being employed by the state.
But should it be 500 people making more than the governor makes?
Taking notice of Warren's findings, Senator Justin Reedy taking to social media, calling on his fellow lawmakers to take action.
Well, we could start out by looking, instead of looking at the developmentally disabled community so much, let's look at the people, the bureaucrats, the people making money off of our tax dollars, and let's get a better handle on that.
As families brace for those potential cuts, Warren echoing that call, arguing her report shows the money is there. It's just being spent in the wrong places.
They cannot do this to the families, to this program that we depend on, especially when there are other ways to do this. This is ethically wrong. It's morally wrong.
Now today, I also reached out to the health department and the governor's office asking for their response to Warren's report. I also asked if they were open to cutting back on overtime spending before cutting back on disability services. As of News Time tonight, though, I have not heard back. Reporting in Baltimore City, Rebecca Pryor, Fox 45 News.
I'm Mary Bubala. Thank you for watching. Here's another video for you to watch. Also take some time to subscribe to our YouTube channel.